So rather than doing formal introductions, what we're going to do is have each of our panelists introduce themselves and say a little bit about how they fit into the discussion of brain capital and the brain economy. So we're going to start with Alice.
Hello?
Yes, yeah.
Okay. Well, good afternoon, everyone. My name is Allison Clayton. I'm the CEO of the McKnight Brain Research Foundation. It's a private philanthropy based in the U.S., focused exclusively on research and education on healthy cognitive aging. I'm a neuroscientist by training, and I've worked in different sectors within both philanthropy and the U.S. government. So most recently, I was at the U.S. Brain Initiative, which was a major effort by the U.S. government to develop tools and technologies to advance neuroscience understanding and effect impact. And so for me, I think what really brought me to be thinking about the brain economy is the opportunity to really dig into how brain science can be helpful, not just in terms of health impact, but really thinking about overall economic impacts, and particularly in terms of cognitive aging, the importance of understanding normative trajectories. So we focus a lot, and rightly so, on pathologies, the importance of disease treatment and prevention, but we don't understand how those efforts are actually riding on top of the overarching landscape of cognitive development over the lifespan. And so, but this is the time to do it. And so where I see that is because we have incredible technologies now in terms of our advances in human neuroscience, in wearable and sensor technologies, to start making those quantifiable, objective measurements at the level of the individual over long time periods. By understanding these trajectories and the mechanisms and processes that drive transitions through the life course, we start to be able to understand at early stages whether these trajectories will differ as related to disease prevention, how modifiable risk factors then intersect with the diagnostic features that we care about later in life, and also will inform treatment because we understand what normal, quote unquote, looks like. It comes back to the classic case of a scientific experiment. You have your case and you have your control. If we've never really understood what the control is, how do you really understand when the trajectory goes off course? And particularly as we go early and earlier in life, that is going to be as more difficult. And so I'd like to make a big push to advocate for understanding normal cognitive development.
Great. Okay, David, up next.
Hard to follow that. So I'm David Gow. I'm the CEO of the Center for Houston's Future. So we're down in Houston, just down the road from Harris Ayer, and he was the one who introduced me to this whole opportunity. The Center for Houston's Future's mission is to enhance the long-term well-being of the Houston region. So we work on a lot of long-range strategic questions for the benefit of Houston. And one of the things we have done over the past few years is, the center is orchestrate a repositioning of Houston from being the oil and gas capital of the world to becoming the energy capital of the world. And there were a whole lot of steps we took, a lot of actions levers we pulled, people we convened to make that a reality, to take nascent, early stage, promising energy technologies, support them, scale them, and tell their story so that Houston had the full swath of resources to lead in energy. So Harris knocked on our door and said, what has just happened in energy, this transition needs to take place here in Houston with the brain economy. And as we've been unpacking this, there are a wonderful set of analogies, activities, and outcomes that we're going to leverage from our learnings and work and energy toward the brain economy. And I'll share more later on them, but that's why we're here, and we're very excited. The Center for Houston's Future is all in on taking all the steps and pulling all the levers we can to position Houston to really be a lighthouse in the development of the brain economy.
Thanks. And last but not least, Valerie, and in addition to the titles that are listed on the slide, she is also a founder and CEO, so I want to make sure you mention that as well.
Thank you so much. And, I think that my interest in the brain economy really is illustrated by my whole academic journey. And I wear many hats. I would say none of them white. I have a black hat. So I guess I'm the villain in many pieces. But I started my academic journey. I'm going to give a geography lesson to Canada very quickly in Newfoundland, which is on our east coast. It's very small. I went to medical school there, wanted to do psychiatry. Population of 500,000 people. Figured I'd find out too much about my family tree if I did psychiatry there. So I had the opportunity to move to McMaster University, where I did psychiatry and a PhD in neuroscience. And I did my PhD in neuroscience because I was really concerned about psychiatric medications and just the impact and the cost of the medications. I felt I was being asked to tell people to pick which chronic illness they wanted, depression or diabetes, because the drugs caused so much weight gain that people were getting diabetes. And so that really started that innovation journey to look at how could we decrease the economic impact of the psychiatric drugs. I subsequently got recruited to the University of Toronto, where got really immersed in that innovation infrastructure, and the best place for us to actualize our vision was to come to the amazing University of Calgary, where we all have the privilege of kind of being at this event here today, because there's a real focus on innovation. And we started with the university, started to commercialize our research into building new therapeutics that we hope are going to be helpful. And, again, part of that innovation journey. And then I'm staying at the University of Calgary because that's 4 alumni series of dues I'm paying, and I can't afford anymore. That's a lot of universities. And more recently, I took on a role at Health Canada as a departmental science advisor. So looking at all things regulatory with respect to novel drugs, to things moving across the border. And so looking at the brain economy from that perspective, and how can we improve ways in which things get regulated? How can we partner with other countries? How can we create efficiencies in that aspect? And so, I think the brain economy has informed all parts of my academic journey, and really grateful to be here talking to you guys about it today. And I'm glad that I didn't know it was called the brain economy when I was doing it. It was just, this makes sense because this is, things we need to unpack. And so really glad that there is now a focus on this area. So really grateful to be talking about it today.
Okay, thanks to all of you. David, I want to start with you because you mentioned the work that's happening in Houston. There was a big announcement recently, a commitment from Houston to really dive deep into this area. So I wonder, for people who aren't as familiar with exactly what's happening there, can you fill people in a little bit more about this transition you're talking about from, not even just oil and gas, but energy into brain? How did that happen? Where is it now? What advice do you have for people on that?
So you bet. So 2 things. On the funding, this is an amazing thing that has just happened, but the Texas State Legislature has passed funding of $3 billion to be dedicated to research on dementia. So this is a wonderful step for all the researchers working on dementia in the Houston or Texas-wide region. It follows what the state did about 8 to 10 years ago with cancer research, a huge level of funding to support cancer research, and there were really great outcomes of that were the foundation for making the case for this kind of funding for dementia. So wonderful new resources available, great funding coming from the state. The work that we're doing at the center is parallel but a little independent of that, in that what we're going to do, analogous to what we did in energy, is we're going to go out and convene all the leading players that fall under this umbrella of the brain economy. And that will obviously include some of our research institutions, medical institutions, some large corporate institutions. I think there'll be some foundations that will want to be part of this effort as well. We'll convene them. Now, to be sure, some of them are competitors, and competitors don't always sing and dance and play well together. But the size of this pie, the opportunity is so large and frankly so important that I think we can rally people around it, just as we did with energy transition. It was an important economic case, and it was an important human welfare case that we reduce carbon emissions. And in this case, there's both lots of capital growth opportunity and human flourishing. And so I think we can rally people around that, convene them there, and then the activities and outcomes that we intend to get, which we've been able to do with energy, include holding regular conventions to build visibility to the opportunity, to network into the opportunity. We'll have a sweeping set of conventions to connect people. We will have, I'd be very disappointed if in 18 months we don't have a new innovation hub dedicated solely to startups in this space. And when we develop innovation hubs, we have one now called Greentown Labs for Energy. Would love to have one in this space. And when we develop innovation hubs, it includes a sweeping set of programs and activities and support infrastructure for startups that includes things like a mentor network, shared services network, angel network for funding. We will be recruiting VCs and PEs who have an interest in this space to provide capital to enable scaling. We're going to bring in some of the large medical institutions and research institutions who can be helpful and supportive to these startups in this space. As we all know, sometimes there are wonderful things that come out of research that are hard to commercialize. So these innovation hubs really serve that purpose, and we think we can move the needle there. And then lastly, when you think about all the things we're doing, from capital to innovation to research, et cetera, a big part of this is the storytelling. It's the marketing. It's putting a spotlight on all of these developments. And as we do that, we think we can really make a whole that is better than the sum of these individual parts and position ourselves to be this lighthouse, this catalyst, and everything we do, we'd love to collaborate with everyone else in this room, because this is a question for all of us, how we enhance the brain economy. We would love to think that Houston can be a leader in it, and we will pull every possible lever to make that a reality.
Yeah, it's really exciting, and congratulations on such a great achievement there, and the vision. It's a big vision. Now, one of the things that often we see is, so people are saying, okay, that much money for dementia. What about autism? What about, pick your favorite neurodegenerative disease or brain health condition. Often what we do see, as someone who funds in this space, is there can be overlap, right? So we were talking a little bit about this at lunch, right? So, if we fund Neuro, which you might say, what's that got to do with the brain, right? But the people that they're treating are more likely to end up in long-term care, and if they got dementia, then they're more likely to end up with these sorts of issues, right? So everything is kind of interconnected. And Alice, I wonder if you could maybe think about, is it that, a rising tide lifts all boats? So yes, it's starting in dementia, but it can transfer to others? Or, should it be something that people are worried about if they're not in that space?
Yes, absolutely. I think one of the things, and it's understandable, when we think about from the clinical perspective and the public policy perspective, you have to make categorical decisions. You have to create clinical cutoffs, and you have to draw bright lines, because at the end of the day, you need to make pragmatic decisions. So because of that, we have categorical definitions of all these diseases, but biology is continuous. It's highly dimensional. And so I want to be able to, the pragmatic part obviously needs to continue being there, but I think there's this growing awareness that we need to think about mechanisms across the lifespan at different levels of organizational complexity: the genetic, epigenetic, molecular, cellular, and then how does that start to come together to create emergent properties at the microcircuit, mesocircuit, and macrocircuit to eventually contribute to what we call the mind, cognition, and behavior. Whether those trajectories then go off course in things that we call autism or dementia at different stages of life, those are important labels, but they are actually labels that are riding across this multidimensional mechanistic lifespan processes that are always happening. And so I think there's these two sort of concepts that we need to hold together, respect them both. One is that you have this incredibly complex complex, multidimensional biological system here, and not just the brain, but that it's interacting with the body, and that the brain and body are also interacting with the environment. And that context will set the stage for those multi-directional interactions. And understand that that continuous system ultimately does need to have defined sort of categorical cutoffs and labels that we use, but those labels should be held lightly, not in the sense that we respect them, but we also know that for every disease that I've been working with, everyone calls it a spectrum. Maybe autism spectrum got ahead of it and said, well, we call it autism spectrum disorder, but Parkinson's, these are all spectrums, because ultimately we are talking about continuous processes that we imposed necessary categorical divides.
And Valerie, I wonder if you want to chime in, because I know, you've got an interest in microbiome, which the brain-body interactions, but also from the work you've been doing advising Health Canada in terms of regulatory approaches. If people want to advance the brain economy and really to create brain capital, what is your advice for people in terms of heading down that regulatory path? Do you need to pick a lane, or can you just say, it's for all brain? Like, what's the right approach?
Well, I do think we need to make it easier for people to collaborate within countries, but also across countries. And, we need to make sure that the regulatory pathways have been harmonized both in Canada, in the US, in Europe, in Australia. Wearing my researcher hat, I've been part of some unfortunate events where somebody's done a clinical trial in the US, which was 10 weeks long, and then they try to get approval in Canada, but no, in Canada it needs to be 12 weeks long, and so you have to start over again. And some of these numbers are arbitrary, and so we really need to make sure that where it's at all possible, that we really reduce those barriers, making that those processes seamless. And that also speaks to across institutions. We need to try to harmonize contracts and legal pieces and ethics so that we can work together easier. We need to make sure that there are no barriers to preventing collaboration, because to kind of speak to what you talked about, lots of times these things are spectrums, and somebody's doing research on dementia, and someone's doing research on autism, someone's doing research on depression, that there's a lot of similarities and a lot of data sharing. And so the open science has been mentioned a couple times earlier today, and I think that whole concept of open science and sharing resources and sharing data, so that the work I'm doing informs things that are happening in Houston, and the work that's coming out of Houston informs things that's happening in Paris. I think that that's how you make big innovations, and we've seen that happen during COVID. We saw what happened when science came together and said, we have a problem that we all need to solve. And we used to joke about the speed of science, but I think the experiences during COVID showed us that science can move rapidly when we have shared priorities and we share between institutions across countries, that we can make amazing advances quite quickly. So I think that that is the goal, and I think regulatory has space to help with that, but so do individual universities and individual cities.
Right. And Linda LaFontaine spoke so well about the open science issue, and also the importance of putting patients and end users right at the center of all of the work that's going on. David, I wonder, does that give us a clue about how we might be able to have the wonderful things happening in Houston? You mentioned you want to partner with everyone in the room. How do you envision that? So just say, with Canada, since we're sitting here in Canada, like, how do you envision that, and do these sorts of networks of patients maybe come into play there?
Well, at the very least, this is a wonderful forum and chance to meet. I met David from Hotchkiss Institute, and we'll be following up and look forward to his coming to Houston. I think there are wonderful opportunities to collaborate. We have a lot of work to do just to get our arms around what's taking place in Houston. I'd love to think we can be an extraordinary partner to other domains and places. But even within Houston, we've got to convene ourselves and get ourselves organized. I wouldn't describe ourselves as a finished product yet for supporting and working with everybody. But I absolutely believe what we'll do in short order is have a steering team focused on the brain economy in Houston that could be a wonderful entity to interface with other parties around this room.
Yeah. I'm wondering, like, how do we square that circle of open science with advancing, the brain economy, especially if it's linked to patents and venture investments and companies? How do we make sure that there's the openness so that things can continue to be shared, but we're still growing the economy? I don't know if anyone has any thoughts on the best way to do that.
Well, I don't have an answer to that, but I can say that, at least in the U.S., we're certainly the science infrastructure and the current models that we've had since World War II, those are very much in flux. And as sort of challenging as that time is, I also think it's an opportunity for all of us that are in the field to start really rolling up our sleeves and thinking about the models that we've been sort of in the back of our minds or having past convenings, and really start to put them on the table, because we have to find a new playbook. And so I think this will be a very interesting time over the next few years as we think about how different sectors see themselves as, oh, I'm just the commercialization part. Oh, I'm just the infrastructure part. Oh, I'm just the basic science part. Because I think that's simply not true anymore. And as sort of anxiety-provoking as that can be, it may also open the opportunity for us to take all these sort of conversations and convenings that we've had over the last 2, 5, 10, 15 years and start to say, how can we work together in new ways and create new models and frameworks for advancing science and medicine in a way that aligns and actually supports the economy, the labor market, and business?
Yeah, and many of you have worked across different sectors, right? So how do you see, for example, philanthropy and government and business? What are the different roles that each of those plays, and academics as well? What's the best way to get everyone to play ball?
I think just opportunity and these, I've heard different terms used, like collaboration spaces, and kind of where you force people to interact, because for us, we've so much benefited from being in rooms with individuals who understand the business pieces. And, here at the University of Calgary, there's a lot of these collision spaces where they connect kind of business and law and medicine, that whole innovation hub. And so I think that there is very much a lot of benefit to come from that. And then where you create ways in which other people can mentor, so you can learn from those that have come before you. I would always joke that certainly, the biggest thing that we have to offer is a way to tell people, don't do all of the things that we did and save yourself some pain. Here's the wrong way to do it. But that's invaluable. And so I think that those pieces, and then being linked to individuals in regulatory spaces, making those types of connections seamless and easy. We've spent a lot of time talking to very well-meaning individuals who were just the wrong people, and they didn't know it and we didn't know it until we had sort of spent some time doing it. So really clear pathways, I think, and processes to really help with that collaboration space, and funding opportunities that support those types of things. I think for us, the easiest or the most important pieces was funding, not for the science, but to help with patent fees or all of the other pieces that we didn't know about. And so getting creative when you think about funding brain science, it's not always about funding brain science, right, if depending on where you want to push that agenda. So I think that those types of opportunities, and that kind of networking events like this one can be huge. And having funding, for us, our first funding, shout out to the Ontario Brain Institute. Even though we're in Alberta, they have a national mandate. It was really important. And so I think thinking big and broad and trying to collaborate cannot be oversold.
One easy example, just to toss out one practical thing that we've done in energy and frankly some other tech innovation hubs, is when we set up our innovation hub, ideally there'll be 6 or 8 or 10 others being set up in other places across the world. And I think it's really helpful if we can carve out 5 of the 50 entities that we have housed in ours and have them go and spend 6 to 8 weeks at another innovation hub and vice versa, and shift everyone around and get them exposed to other thinkings and other places and the research institutions and medical institutions that are all around those other innovation hubs to cross-pollinate the best ideas and to help with the scalability of those businesses.
Absolutely.
So I wanted to give a third example. I'm thinking about going back to the brain economy and sort of these new models in terms of who is going to be funding the science, the early stage stuff, the early translational experimental medicine. If we think about workforce productivity, and that seems like a very important aspect of the brain economy, one of the things is how can we better support workers at different life stages by understanding both their cognitive strengths and weaknesses and helping to really empower them at different stages of life. So we're going to have 2 pressures right now. We have an aging demographics, and we have the influx of automation for entry-level positions by AI. So we're going to fundamentally need to change how we interact with technology, AI, new skills, reskilling, and also really adapting and optimizing how we sort of engage our workers at different life stages. So if you're able to sort of understand sort of the cognitive and biological profiles and the brain profiles of your workforce at different life stages, you can actually increase productivity because you're working with what they are better at this life stage than trying to sort of pigeonhole them into what they could have been or they were 20 years ago. And so I think it's sort of a maximizing and leveraging the fact that we go through all the developmental lifespan.
Yeah. So we want to open it up for questions from the audience, and I think someone's going to come grab a mic. While that mic is coming, raise your hand if you've got a question while they're going there. I just want to come back with one more question here following on that, which is, again, coming back to Linda's comments and the importance of really putting patients and end users and their caregivers at the center of innovation. In your minds, at CABI, for example, we've got our lived experience advisory panel, our LEAP panel, and our seniors advisory panel, where all of our innovators, all of our researchers have an opportunity to co-design and co-develop, whether it's research or policy or innovation, with the people who really matter. Like, we're doing it not for ourselves, it's by and with, not to and for. So what do you think about the importance of centering, whether it's from government, whether it's from companies, whether it's from researchers or philanthropy, centering it around the end users and their caregivers?
Well, I think that's key. We can't create the solutions that we think people need. We need to ask people what are the solutions that they want. And again, for me personally, I was doing a whole other area of research, but I still practice clinically, and I had just serendipity, had a couple patients, so our area of research is on the gut microbiome, who had been sick for a long time, had taken antibiotics for different procedures, got well, and said, did I get well because I took an antibiotic? And I said, I have no idea, but I'll go find out. And 15 years later, here we are. And so it was a form of research that was completely informed by the questions that my patients were asking. And, as we've gone through this journey, we've done a couple research papers where we've just interviewed patients and said, if this is, these types of treatments were available, is this something you'd take? Why or why not? And that's really informed how we've designed our studies, how we've interacted with regulatory bodies. And so I think sometimes it's easy to chase the science and chase the funding. If there's something that seems to be, this is what the funders are wanting, so that's where we're going to go. But that's actually not what the community is looking for. That gets tricky, and that's where we need to engage, I think, more with our funding bodies. But that's also where philanthropy can be really helpful, because oftentimes philanthropy is informed by many through their own lived experience of kind of family members or frustrations with the system. And so I think, really engaging in philanthropy and engaging in well-run patient advisory boards is key, because they can tell us the questions that we should be asking, and they can tell us what's not working.
Right.
Exactly. I think, I couldn't agree more in terms of listening to the community and working closely with them. I want to extend on just defining the needs better and go even further and say, using their learnings to then develop hypotheses that we can take back to the lab. What I find in families and individuals with lived experience is that, hey, just like the rest of us, they got to get through the day. And so they come up with lots of really interesting solutions to get through the day. And that, while it may be anecdotal, I don't want to dismiss the importance of those kinds of compelling stories, because they can provide small sort of teaser and pilot questions that we can then further explore through a different approach, through the scientific method. But these are all different observations that we can further study through science, through real-world experiences. So I think the patient and the stakeholder community are incredibly valuable, not just helping to define our targets and our goals, but in fact our partners in developing those solutions, because they are developing solutions for themselves every single day.
Yeah, great.
I love what you have done by bringing the patient back into the perspective, because it underscores the need for a holistic perspective on brain health. I mean, my own personal experience, I had sort of I think of it as a goofy health issue, restless leg syndrome. But when I would walk in with that condition, each individual doctor, based on his or her background, domain, and expertise, prescribed a solution based on his or her domain expertise. And it was based on what they know rather than what I was experiencing. And so here's the opportunity to connect the dots between the real patient need and condition and a more holistic look instead of a domain-specific look. And if we could get that right, if we could crack that code, particularly relative to the brain, I think the outcomes would be just astounding.
Absolutely. Questions from the audience? Yeah. Maybe when people are asking questions, just introduce yourself very quickly, who you are, where you're from.
Is this on? Yeah, Morris Friedman. I'm from University of Toronto and Baycrest Health Sciences, and I'm a neurologist. And I was very pleased to hear the clinical focus in this discussion. So what it leads me to ask is about the term brain health. Brain health is in this equation of brain health, leading brain skills to brain capital. The problem is, or a problem is, that brain health, the term, means different things to different people. And it actually hasn't been explicitly defined. And for many people, it refers to the early phases, prevention. For some people, it refers to the whole spectrum, where we want to maximize function right across the stages of dementia. So to get more traction, because you want to get traction not just among the politicians and the economists, but also among the clinical types. So my question is, should we take that formula, for example, and break brain health down into, instead of brain health, prevention plus maximizing function in dementia, or some catchy term? But basically what I'm saying is, and I've spoken to different people, and I've raised, in fact, at a clinical meeting, maybe we should be talking about brain health. And people said, well, brain health is too diffuse, it's too widespread. What does it really mean? We're talking about dementia, let's call it that. So maybe you would get more traction if you had a term or a definition that really expanded it and appealed to the clinicians, the people who look after people with dementia, the politicians, the economists, the business world. The brain health is too diffuse by itself.
So for folks, because folks here have experience with government and with with a lot of different sectors, and I've had some conversations with Harris around brain supports as well as brain skills, and is that embedded? So from your perspective, what's the best way to couch the brain capital and the brain health within that?
I mean, I understand where you're coming from, and I experience it myself. You're just like, oh, it's so diffuse, it's so vague, anybody can say that. And I think at some point that I'm actually okay with it. I mean, that's obviously my own personal opinion, because I don't see it as an or situation. I see it as a yes and, which is to say that we have this very big tent, this broad umbrella that quickly orients your audience wherever you're coming from, that we're talking about brain health. Then the onus is on you or your organization or whoever to then specify more deeply where in that space are you interested in. I think for me, in terms of what I find, beyond like the importance of brain health being discussed beyond brain scientists and brain, clinicians, which I think is where it has been for so long. I love that brain health is discussed now in the public with the policymakers, and that makes it accessible. And then I can always go in and layer on top of that what I happen to mean in that conversation. The second thing I just wanted to mention that I think is really important is that, and I worked in the psychiatry field, and the addiction field, and the autism field for many, many years, and it's always been about cures and treatments, which those should absolutely be at the top of the list and continue to be at the top of the list. So it was this sort of always about making things removing bad things. It was about alleviating disease, curing disease. But the other side of the coin is about promoting health. Yeah. And they are the two sides of the same coin. And that's why I like the term brain health, because it sort of elevates the need to promote resilience, understand health as a broad continuum that includes, but is not restricted only to disease alleviation or cures.
It is interesting. I remember the slide from McKinsey, they had brain health, brain capital, brain economy, and then you have to read through those different definitions, and then how many of us took those definitions away and can re-articulate them so that we're all speaking the same language. It's a challenge, to be sure. And Richard at the beginning said we should all leave here with our ability to explain our own statement about what it is we're actually doing and pursuing here. To me, to get over the question of, my goodness, if we're talking about brain health, everybody sees it's dementia, or it is depression or anxiety or mental health. To me, the only way I can get around it, and I've been using this and it seems to resonate, is to say that this is a holistic life cycle work on the health of the brain that will unleash economic growth and human flourishing. And if we tie those things together, it does bring in this notion of the brain economy and brain capital, because we're unleashing economic growth. But yes, brain health is the foundational element that enables all those things. So I like to think of it that way, is we got a holistic life cycle set of work to do on brain health that will unleash economic growth and human flourishing.
Thanks. We've got time for, I think, another question or two. We have a couple minutes. So is there another question?
Hey, my name is Tim. I have a quick question for you. Who isn't in the room here that should be here, and how do we bring them in?
Great question. Who's not in the room who should be here? And how do we get them to be here?
I just think more of everybody. We need more researchers, we need more universities, we need more global scientific institutions, we need more representatives of cities doing great things, we need more governments, we need more patients. And so I think we have all of the right people, we just need more of you guys and more of us. And so I think go spread the word, share the things that are happening, and I think that advocacy and promotion, I think, will go a long way, and then we'll identify if there are specific gaps. Perhaps we need more business. Maybe we need more media in the room to really amplify all of the things that are happening. There's a variety of different stakeholders, and I think my philosophy is always bigger is better, and so I just think more and to grow and to inform everybody who's here so you can go out and advocate and bring more people back at the next meeting.
So I think it's a great question. One thing it does highlight for me is right now there are conferences happening all over Houston and the country around AI, and the rooms are double this size. For some reason, AI has captured the attention when I find this topic so much more exciting and invigorating to think about human welfare and human critical thinking. AI may undermine critical thinking in the humanity. This is an opportunity to enhance it and grow it. So I think one is there needs to be a little bit of a redirect. This is a bigger, better opportunity that warrants more attention. And to get it, I do think big business is a part of this story. We probably have more science and medical in the room today than we have business and scalability. If in fact the numbers are right, that this unleashing of the brain can render this kind of extraordinary economic growth and GDP growth that is just outrageously grand, the same FOMO that businesses are experiencing with AI, they ought to get here with brain health. That's a big time opportunity, and they ought to be in the room hearing about it and experiencing it with us.
So I would say AI needs the brain because AI became AI because of the brain. It went from machine learning, and because they really started to understand the 6-layer cortex and the computations that were happening, that's when that was the secret sauce. That's when it actually really changed over the last few years to become AI. And so AI is actually, they are indebted to neuroscience and indebted to the brain. And in fact, what they need now is actually more understanding of the brain because it is far more adaptable, efficient, and safe and stable than current AI. So they, in fact, need us. And so I think this is a virtuous cycle of studying both AI and brain interactions, both in terms of information sharing, but also understanding what we can benefit in different ways. So I won't even get into it, but for example, neuromorphic computing. Yeah. That is going to be a major piece of addressing the power-hungry, and not in the conceptual, like the literal, problem that we have with AI right now. The brain works so much more efficiently than current AI does. And so they will continue to need us. And so maybe one constituency that's missing here is everybody that's like so has stars in their eyes with the AI and the need for it, and understanding that if you want to make it better and you want to also maybe use it to also understand humanity better, then we need to be talking.
And not destroy humanity along the way. My response would also be, I think we need more funders in the room and more decision makers. I mean, there's some of us here who are funders, but I don't think that proportionally there's probably enough of those types here. And we need people who are able to make decisions for government, right? So that's, I think, the next challenge that we would have, in addition to these others. I think also bringing in the people from the other sectors, climate change and housing, I mean, the other issues that are top of mind, it's all related to the brain economy and brain capital, right? If you want to solve any of these issues, it's all interrelated, and making sure that it's again, not being dealt with in these distinct sectors. Is there one more question?
Doug Sakadny from the Neuroscience Mental Health Institute in Edmonton. Go Oilers. My colleagues will smile, but just to remind everyone that we talk about brain economies, but there's a nervous system, and it includes the peripheral nerves, it includes the spinal cord, Hereditary spastic paraplegia is a problem of connections in the spinal cord, so it's a much bigger picture. Restless leg syndrome is likely a disorder of the peripheral nervous system. So it's a wide area, and just want to make a plug for that as well.
Yes. And I know Valerie appreciates that because you're also brain-gut interactions. And
Yes, my connections, our brain-gut makes even less sense. The brain and peripheral nervous system, very much so.
Yes, and I think one of the areas that we're really advancing in terms of the development of devices and neurotechnologies is developing devices that can sense the interoceptive system, the gut, and these things help us to better understand sort of this brain body connections, whether you talk about the peripheral nervous system, central nervous system, enteric nervous system, all of these things, we're starting to actually be able to quantify the relationship among these through a technology and device-driven sort of movement, and that because we have all of this technology, we're also able to start looking at it under ecological conditions. So it's no longer under these super constrained laboratory environments, but it's starting to go into naturalistic environments. Sometimes we call them freely moving animals, freely moving humans, and you can actually see how people, their brains, their minds actually interact with that environment because we're able to handle that data now. And so I think that's, again, another opportunity to take science and research out of an purely academic setting and start to look at what it looks like in context.
we call it wild neuroscience.
Wild
neuroscience.
neuroscience in the wild, that's right.
So I think we need to wrap up. I'd like just one last statement, maybe from each. Your take-home message. Valerie, we'll start with you.
That I think that we do need to look at how the biggest successes in the last decade were accomplished and build on those models. It's about shared science, it's about collaboration, it's about, unfettered access to funding because there's a desire to make a difference, and I think we need to build on those models.
Okay, thanks. David?
The way we think about it is that we really need at least three components. Collaboration is key so that collectively our efforts yield more than we would individually. Collaboration is key. Second, we really want to work with urgency. We want to have a bias for action. The call is now. And then thirdly, we really want to work in an inspired way. And when I say that, at least I feel like when I look across my professional life, there's probably nothing that we could work on that could be more impactful and have more meaningful outcomes than we could have here with both economic growth and human flourishing. So this is what excites me so much about this project.
I would say that science is core to the brain economy, but only if it reflects the needs of society, including the economic needs and priorities. It should benefit society in a way that's tangible, that's pragmatic, and that feels like it's just a way of thinking. It's not a list of science, it's not a list of facts, it's a process, it's a mindset, it's a way to explore and understand our world. And if we can take science and utilize it for pragmatic questions that address all of our the issues and our interests, that is how we're going to make it more holistic by actually having these bidirectional, multidirectional conversations and projects that actually reflect the really core need for science and society to be interconnected.
Yeah, and my take-home message is on the screen there. Our Prime Minister said, build big, build bold. I don't believe we can do that unless we're also building brains. So with that, I want to actually give you each a brain. You can pass those on. And thank you all for a great discussion, and thank the audience for their attention. Thank you very much.